My name is Dr. Peter Njiba. I am a medical doctor and I'm a specialist. I specialize in neurosurgery. That is the area where a specialist operates the head of a patient and the back, basically the nervous system. So I am a citizen of Guneku, if I could put it that way. I was born in Bamenda and I spent all my childhood life in Guneku. I went to school I started in GS Guneku. That was primary 1 and 2, and then I went to Kali School in Jindom. That was primary 3, and then I completed the rest of my primary school in government school in Bemi. Then from there I went to government bilingual high school in Bengui, where I obtained my advanced level certificate. Then after that, I actually decided that I should be a missionary, saving the Lord, with the St. John of God Brothers. From that, I got the opportunity to go to the medical school. That was when I went to Ghana. I started my medical school in Ghana. I studied until I had my medical school certificate as a doctor. So I have been practicing for over 10 years, after which I decided that I should go and do my specialization in neurosurgery. So once I completed my neurosurgery specialization, I decided that the first thing I should do is to come to the place where it's my village and serve them. And this year, in the month of May, that was when I came to Guneku, and then the founder of Guneku, His Royal Highness Dr. Fomiki, teacher the 9th, assigned me to take over the health needs of the village because of this new hospital that we wanted to open in the village. So from that time, I became so faithful to the responsibility that His Royal Highness entrusted to me, to make sure that there is health for all, to all the citizens of Guneku and the villages surrounding Guneku. It's not an easy task. They say that one would have to multitask. First and foremost, I would have to, keep an administrative structure back here in Guneku Medical Center. I have to make sure that there are people who would manage the hospital here at home, and then when there is difficulty, then they call me in Ghana for me to intervene. And I've been doing that almost on a daily basis. And that is how I want to tell the people that even if I'm not here in Guneku, that I am physically present through the technology that we have, through WhatsApp video. You call me, I attend to patients on WhatsApp video. We use the diagnosis, I give the treatment, they manage the patient gets better, and the patient is discharged. In fact, we have been thinking of taking the face of the hospital to the world, because many people don't know much about Guneku Medical Center. People would just come and say, where is it located? Are there specialists there? Are there health personnel there? What are they doing there? So I decided, with the endorsement of the board chairperson, His Royal Highness Dr. Fomiki, teacher the 9th, that we should organize this campaign first and foremost to publicize to the people of Guneku and the villages around that Guneku Medical Center exists. And secondly, we can also show them that there are certain things that we can do that they don't know that we do. And that was why we came out with an announcement that those patients with certain conditions should come, and we would attend to. I, as a neurosurgeon, I don't only work on people that are just in my area of specialization. I know most of the things in other specialties. So first and foremost, we have any person who is mentally unwell. So if you are mentally unwell, you come to us, we look at you, and we give some investigations. It could turn out that you that are mentally unwell, what some people will call mad people in quote, maybe there's something in your head that we could just look at it. If there's something in your head, we can quickly take you and go and open your head, remove whatever is in your head, and then close it back, and then the madness would go away. And that is how we put that on the program, that those who have such conditions should come. And we have seen about 2 coming during my visit, and we actually did an investigation. They are yet to come with the results. We also talked about children who are growing up, but they cannot actually do well in school. There are a lot of conditions in the head, because children, they have the brain that is growing. If they are not understanding well what the teachers are saying, something must be in the head that is causing it. So I want to look at that area, because as a neurosurgeon, we want to look at that and make sure that there's nothing in the head that is contributing to that, so that we make all our people in Guneku and the villages and the surrounding villages, to be having things in the head like tumors that is going to be there, because there are very few neurosurgeons in Cameroon. So I decided that let me make this campaign to make sure that I widen the scope of neurosurgery and get most of these patients, so that when I see them, I will take them to Yaoundé, to Better Health Center, and actually do an operation and remove it and restore them to good health. We also have patients like women with abnormal bleeding, pregnant women. If you have prostate problems, you can come, we will take care of you. If you actually have even simple malaria, any normal illness, because I said I am a neurosurgeon, but I am very good in other areas of specialty. Yes, I can tell you for a fact that most of those on the street, it's unfortunate that their family members may not care for them so much, because you need a supporting family to help somebody who is sick. They may have been abandoned. And looking at the fact that investigations for such people in Cameroon is very expensive, I think if there is a way that we get them, grant the necessary investigations, CT scan of the head or MRI of the head, we would definitely see some of them having brain tumors being the cause of their madness. Not to say that all madness are caused by brain tumors. Those that are caused by brain tumors, you definitely have to do that, operate them. That would take away most of their madness. Those that you do the necessary investigations, then you don't have any lesion, any tumors in the head, then you know that there are other specialties that can take care of them, like the psychiatrists. They have medication given to them, and that is where we work hand in hand, in the neurosurgeons and the psychiatrists. Any person in a psychiatric hospital may have gone through these investigations to know that there's nothing in the head first, in order to continue with the medications in the psychiatric hospital. Unfortunately, the first day we had some minor itches. We started our campaign a day after the publicized campaign. When I came in. On that day, we had a total of about 28 patients on that first day. Second day, we had about 24 patients. The third day, we had about 20 patients, and then the fourth day I wasn't actually around. I couldn't come, but I came with a colleague doctor who sat in for me, and unfortunately that day was packed. We didn't get a lot of people coming to the hospital, so we got about 5 patients. So when I resumed work the following day after a 24-hour rest, I got a lot of patients, about 30. And today we got about 15. It's a Saturday. I hope the following days, the subsequent days, many people will come to our doors. We mostly have the population of Guneku made up of the aged, unfortunately, because our young people have all migrated to the cities for reasons best known to us. So because of aging processes, most of them come with body pains, arthritis, back pains, and then those were the common diagnosis we have here. And then that is where you have to talk to them, give them medications, and advise them on physiotherapy. But there are other diagnoses that we saw. Have people with prostate problem, because it's also part of the aging pathology in men. Some had cancer of the prostate that they needed to be referred to Better Health hospital in Yaoundé, where is a specialist hospital for urology. So we did 2 referrals there. We had women coming in with infertility problem. We have another one with ovarian cyst, like water in the ovaries. We had a little child that came in that saddened my heart. She was pregnant, and that is a call for all of us to make sure that we protect our girls. She was pregnant, and we had to advise the parents on how to go about the whole process of taking care of her and the baby. My vision for the Guneku Medical Center is that I want to get everybody on board. Is the center hospital for all of us. That's why they call Guneku Medical Center. It is our hospital. The fund of Guneku, who is the board chairperson, he wants to make sure that everybody in Guneku and the surrounding villages, they enjoy good health. So there is a need for us to have a very big hospital here, whereby we can even in the nearest future having people doing spine surgeries, operating the head like what I'm doing. We have a lot of doctors from Guneku, gynecologist, obstetrician, Professor Andrew Tassan, who could be doing a lot of complex surgeries here. Even the board chairperson, His Royal Highness Dr. Fomiki, he is a consultant urologist. He operates on prostate. So we want that we have to grow this hospital to be the best in the whole of Northwest region. Why not the whole of Cameroon? But we can't do that if the people of Guneku cannot encourage one another to come and uplift this place so that we go ahead. I know that we are starting young, like a young hospital, but we will definitely have challenges. I am pleading with everyone that my vision should be your vision. The vision of the fund of Guneku should be your vision. Come and support. To have a hospital to this level is not a child's play. It involves a lot of financial commitment. Okay. And this hospital, as you see, the time that I'm coming here is also to mobilize funding. So you can buy certain equipments in the hospital so that the hospital can grow. And if all of us come together, we would make Guneku strong. I alone cannot do it. The fund of Guneku alone cannot do it. Professor Tasang alone cannot do it. That's the executive members. They themselves cannot do it. Our vision alone cannot bring this hospital to first-class hospital in Cameroon. It is the people of Guneku, and maybe anybody who is listening to us, benefactors, to help and support us. The structures that you see here is not a permanent place. It's just a temporary place. We want to relocate to a permanent place whereby we have to start building this extra modern hospital, first class hospital. I think it will be our pride as Guneku people that the best hospital in Northwest, it is situated in Guneku. I may be in Ghana, but I am always here.